Hello, my name is Kirsten McDowell, and today I will be presenting Missouri Cancer Registry Death Clearance Follow-Back Instructions. I would like to take a moment to acknowledge the Missouri Cancer Registry and Research Center, which is housed on the campus of the University of Missouri in Columbia. The Missouri Cancer Registry and Research Center is supported in part by a cooperative agreement between the Centers for Disease Control and Prevention and the Missouri Department of Health and Senior Services, and a surveillance contract between DHSS and the University of Missouri. Missouri is a research state for SEER. Briefly, the purpose of a central registry is to collect high-quality data for use in surveillance, decision-making, cancer control research, and policy development. Death clearance is designed to improve the registry data quality with the use of mortality files and death certificates to identify missed cases and to update registry records with the death information. Death clearance began receiving greater attention when the North American Association of Central Registries, the CDC National Program of Cancer Registries, and SEER began using the percentage of cases remaining in DC status as a criteria for certification and as a measure for quality. Initially, the registries themselves determined when a case was to remain in death clearance only status. So it soon became apparent that a best practices document was needed to promote consistency and comparability of results. Currently, registries use NACER DC Manual minimum requirements and best practices for conduction of death clearance for deaths occurring in 2013 and beyond. But soon we'll transition to a new updated manual starting with deaths occurring in 2022 and beyond, going into effect January 1st, 2023. As I previously stated, the intent of death clearance is to enhance data quality and usefulness by adding vital status information and other appropriate death information to matching cases in the registry database. This is achieved through a comparison of deceased patients with a reportable diagnosis to the Missouri Cancer Registry database. In addition to this, another important aspect is improving completeness by adding previously unreported cases to the registry. Results from the death clearance process can be used to help facilities determine if there are deficiencies in case finding, and can be used to improve reporting from existing sources. Or it may indicate that additional resources are needed to include in the facility's routine case reporting process. Now that we have looked at death clearance background and purpose, we're going to cover the MCR instructions for completing this process. Death clearance is an annual process, and a system-generated email will be sent to the WebPlus file uploader with notification that there are case fallback forms in WebPlus for their review. I've included the link here for the WebPlus login screen, where you will enter your MCR assigned username and password. After logging on, select Death Clearance Fallback Requests. After logging on, you will see a screen similar to this, where you will choose the tab Death Certificate Fallback Requests. As you can see, it also lets you know how many outstanding requests you have and how many have been completed and released back to me for review. Once you select Death Clearance Fallback Requests, you will see a patient list with a subset of fallback information. I have provided a few example cases for us to review, and if you take a look at the far right column labeled Status, you can see that they are all currently in incomplete status. The status column should state Released when the case has been processed appropriately, or if a case was rejected, it will no longer appear in the listing. The first step is to select Open from the far left column. Once you select Open, the incomplete case will appear on the main resolution screen. It contains patient identification and tumor information. None of this data needs to be changed by the registrar. Also, take note of the scroll bar to the right of the case. In WebPlus, it is necessary to scroll down to see the bottom half of the patient data. Once you have scrolled to the bottom, you will see a text box labeled Release Case Documentation. This is where you will enter your fallback information. Also note that in the top right corner, there is an Add View Comment tab. This is no longer used. Please do not enter data into that section. There are certain criteria to keep in mind when entering fallback information into the release documentation box. We will be taking a look at that information here in the next few slides. One of the most important aspects of death clearance is to find cases that should have been reported but were not. If the patient was diagnosed and or treated at your facility, you will enter missed case into the release case documentation box and then select save at the left bottom side of the screen. The case will need to be abstracted at a later time and submitted to MCR within 30 days. One point to keep in mind is that the tumor information MCR receives from the death certificate is incomplete. Although the patient may not be reportable for your facility, any additional information you have in your records regarding site, histology, stage, treatment is valuable to us. If the exact date of the cancer diagnosis is not known, you may use terms such as a couple, several, or a few weeks, months, or years, if that is what is stated in the medical record. Other terms such as early, mid, or late in the year, or references to the season are also acceptable. You will record the diagnosis date or estimated date in the release case documentation box and select Save. On this slide, I have provided a few examples of the type of information you can enter into the release case documentation box. Brief statements confirming the primary site, histology, known treatment with the diagnosis date are what we are looking for. Remember that estimated dates of diagnosis are acceptable. As you can see in this screenshot example, I have entered follow-back information for this case in the release case documentation box. When the case is complete, select Save at the bottom left of the screen. At this point, an edit box should appear on the right asking if you want to release the case. Select Yes if you are finished or No if you need to go back and add more text at a later time. Once you have selected Yes, you should receive a confirmation message that your case has been released back to the central registry. To return to your pending cases, select Follow Back Requests. After returning to your Follow Back request, you should see that the status of your case has been changed from incomplete to released. Next, we are going to examine how to handle cases that will be rejected in WebPlus. Rejecting a case indicates that your facility may have some information but is not sufficient for MCR to remove the case from the DC process, or there is not any information for the case. If you reject a case, it will be removed from your DC fallback request listing, but it will remain in the MCR fallback file for further action. There may be occasions when you find that a case on the fallback list has been previously submitted and will need to be rejected. In this instance, you will enter previously reported, the date of submission, the accession number, and the BUN number. I can use this information to try to locate your abstract and remove it from the DC process. There may be rare instances when a case cannot be located and will need to be resubmitted. The DC supervisor will notify you if an abstract needs to be resubmitted. Another reason for rejecting a case could be when the patient has been to your facility for a condition other than the death clearance primary, and the diagnosis date cannot be determined. But there is information about the patient being seen in another hospital and or tumor data confirming the cancer. Providing another location where the patient has been seen previously will allow us to contact the other facility and possibly remove the case from the death clearance process. In this example, I have stated diagnosis date unknown, the name of the other facility, and a statement indicating that the patient does not have a known case of melanoma. If a patient has been to your facility for a condition unrelated to the death clearance primary and you have no information at all about the cancer, this would be a reason to reject it. You would enter no diagnosis, tumor, or other information for fallback in the Reject Fallback Request box. Or if the patient has never been to your facility, you will select Reject and enter Not Our Patient. The next few slides will demonstrate the Web Plus steps for rejecting a case. As you can see in the upper right corner, there is a reject button, which you will select. In the Reject Follow Back Request box, I have entered my response of not our patient and will again select Submit. After submission, you will see a message stating that the abstract has been rejected and sent back to the Central Cancer Registry. Select Follow Back Request to return to your list of pending cases. As you can see in this screenshot, the case that we rejected no longer appears in the listing, but it has been sent back to MCR for review. The status of the cases flagged as released are complete. The cases flagged as incomplete have not yet been processed. When the final status of all cases is released, and if all missed cases for your facility have been transmitted, death clearance for your facility is now complete. In review, keep in mind that death clearance pertains not only to patients who died at your facility, but also to any that may be seen at some point prior to death with a cancer diagnosis or a history of it. Ask yourself, can the case be released by my hospital and removed from the MCR DC process, or should it be rejected and sent back to MCR to remain in the DC process? From the MCR perspective, we are looking for confirmation of a cancer diagnosis with an exact or estimated diagnosis date and any treatment information that we can use to update the existing death certificate record in our database. Here are the resources used in creating this presentation, along with the login address for Web Plus. Thank you for taking the time to listen to this presentation. If you have any questions, either after listening or during the time that you are working on death clearance requests for your facility, please do not hesitate to contact me by phone or the email address I have provided here.